Nina Becher, Mike Gibson coming to you live from AHA 2023, and we're talking about rapid heart rates, rapid atrial heart rates, and that many of them constitute AF, and whether treatment with Edoxaban improves outcomes. Talk to us a little about what AHRE is, first of all, Nina.
Yeah, thank you. I really appreciate to be in the interview with you today. So, on behalf of the NOAH-AFNET investigators, I'm really appreciate to present the results. And atrial high rate episodes, are also termed subclinical atrial fibrillations, are often detected in devices such as pacemakers, defibrillators, or loop recorders. And in every fifth patient with a device, these atrial high rate episodes are detected. And of note, stroke rates appears to be lower than in patients with ECG diagnosed atrial fibrillation at the moment.
So, talk to us a little bit about the methodology here. How did you interrogate this to find AHRE, and then you treated with Edoxaban, and the episode had to be over. It had to be greater than 24 hours to be treated, correct?
So this is a pre-specified sub-analysis of the NOAH-AFNET 6 trial, and patients with AHRE durations longer than 6 minutes are included in this trial and also in this sub-analysis. And in this sub-analysis, we looked on AHRE episodes which were longer than 24 hours, or we also used AHRE as a continuous variable or as a median. And when we looked at episodes longer than 24 hours, we compared it to shorter episodes, but no episodes were shorter than 6 minutes. This is important, I think, to mention.
Mhm.
And all our episodes were reviewed by a core lab in Maastricht. And so we are pretty sure, and we know that 97% of these AHRE episodes resembles atrial fibrillation. So they had a high rate with over 200 beats per minute, and they were irregular rates and not resembles a supraventricular tachycardias with regular rhythm.
And did you randomize people to Edoxaban or no Edoxaban?
Yes, this was a double dummy trial. So the patients were either randomized to anticoagulation with Edoxaban or to no anticoagulation. And if they had an indication for aspirin, they took aspirin also in the placebo group and received a dummy tablet in the Edoxaban group.
And what did you find?
So we found that anticoagulation with Edoxaban did not show a reduced composite outcome of stroke, systemic embolism, or cardiovascular death in patients with AHRE longer with long episodes and stroke risk factors. And these results were consistent in patients using AHRE as a continuous variable and using AHRE as a median. And the stroke rate the stroke rate and other thrombotic events was very low in patients with long AHRE durations. But you have to admit that the sample size was very small to rule out meaningful thrombotic events, I think.
And so, what was the sample size, just so we know?
Yes, so the study included 2,536 patients, and only patients with core lab verified AHRE episodes were included in the study, and these were 2,389 patients. But patients with long AHRE were only 259 patients compared to shorter episodes patients, and these were 2,130 patients. So there was an imbalance, of course, in these patients. Yeah, but nevertheless, this is the first randomized comparison of patients with short and long AHRE durations.
Yeah, big question. How much AFib warrants treatment This is a great first step in trying to answer that question in a randomized fashion. Uh, Great job in executing this. I know how hard these studies are to do. I hope you'll continue your quest to kind of figure this answer out. Thanks for joining us today, and thanks to all of our audience for tuning in.
Thank you so much.